com. So with that, I would like to introduce you to today's presenter, Pat Byers. Pat has been consulting in the measurement and evaluation space for over 20 years. She's contributed to building sustainable measurement and evaluation capability through the development of global holistic assessment and evaluation strategies in the pharmaceutical, energy, automotive, and financial industries. She develops and implements measurement and evaluation systems connecting people processes to business impact. This includes creating processes, standards, templates, and job aids to enable the strategy's implementation. She also helps identify performance and business metrics that are used to measure the impact of strategic programs. She also holds a PhD in instructional research and design from Purdue University. So with that, Pat, I'm going to turn presenter rights over to you, and I look forward to a great session.
Thank you, Kayla. Well, good afternoon. It's wonderful to have such a great group here, and just look forward to sharing some of this information with you, and also just hearing some of your feedback and questions. So to begin, these are some of the things that I hope that we'll be able to accomplish at the end of the session. As the title states, we're really looking at the value of beginning with the end in mind. And I'm sure that you've used this or heard of it before, but we're going to just demonstrate why this is really critical and how to consider that when we're designing a program for desired outcomes. And we're going to be using a logic model, and then also reviewing how this logic model can be used for evaluation purposes. And then we'll cover some key takeaways, and part of that will be some job aids that we will share with you at the end of the webinar. So this is a quote that I came across that I thought was very appropriate for this particular webinar. This is from Harold Geenan, who was the president of ITT Corporation. And as you can see here, what he said is that you read a book from beginning to end, but you run a business the opposite way. You start with the end, and then you do everything that you can to reach that particular end. And this is just really important for what we're going to be looking at here in a few minutes, is that looking at the end, or starting with the end first, it'll help us ensure alignment between those expected results and the activities that we'll engage. And so also just keeping in mind is that activity doesn't ensure that we achieve results. So that's the other reason that we're going to be focusing on the expected outcomes at first. So we'll start with just designing for desired outcomes. And I came across a quote from Yogi Berra, and I'm sure you've heard this before. He said, if you don't know where you're going, how do you know when you get there? And so clearly, if we have an understanding of what the problem is, and we know where we're going or what the business results are that we want to achieve, those are the two really key bookends of designing for desired outcomes. One of the other interesting things that I came across was a study that was published by Burson by Deloitte this year. And it was very interesting that they found that only 8% of the CEOs that were surveyed said that they have good insight into the real impact of their L&D investment. And it does make me wonder, why is that? Is it possible that we focus more on activities and we're not really looking at the business results? Or what could be contributing to that particular statistic? So I thought that that was really quite telling. So if we start with focusing on these two bookends, then we can look at what we do in between. to close that gap or to address that problem and reach some of those business outcomes. So some of those activities would be really looking at what do we need to invest, what are those activities and who are the people we need to reach, and then what would we expect to see as far as a change in people's knowledge or skill level and the way they do their work. And if we put those together, will we be able to achieve those desired business results? And when we look at this, this is really the logic model. The logic model is using a situation or a problem, and then it also looks at what are the intended outcomes, and that could be in terms of short-term, medium-term, or long-term. And then it works with inputs. What are the resources? And that can be human or financial. What are the activities that we need to engage as a result or using some of those resources? And what are some of those products and services that are needed? And then from that, then what are going to be some of those short-term outcomes? What changes do we expect to see? Changes or differences in terms of individuals, the way they work, or groups of people, or maybe even the organization. So this logic model methodology, it can be used in the private, public, or nonprofit sectors. It's also a good depiction of the program, and it also shows what this program will do and what it should accomplish. And this is really core to program planning and evaluation. And it can be applied to programs small and large. It can be applied to processes as well as organizations. So it's a very flexible and useful methodology. So let's just take an example and see how we can apply this logic model to this example. So among men and women across racial and ethnic groups, we know that heart disease and stroke are among some of the nation's leading killers, and they also cause disabilities. So we know that most of the major risks for heart disease and stroke are modifiable or preventable, but we also know that 80% of the Americans also report having at least one major risk factor. And some of those risk factors or conditions might be high blood pressure, high blood cholesterol, maybe tobacco use, or physical inactivity, maybe a poor diet or obesity. So those would be some of the conditions or risks. Well, Congress made funding available to use to begin to develop some national health promotion and prevention activities. And what they would like to see as a goal is to provide these systems interventions to clinics so they could increase their knowledge on this chronic care model and clinical guidelines. And they also want to see that the clinic physicians' behaviors are changing, and also they're hoping to see an increase in the number of patients who have their high blood pressure under control. So this is a situation and some of the problems that are wanting to be addressed. So let's try to walk through this case and map it out on the logic model. We understood that the situation is that we have physicians and clinics that lack knowledge of clinical guidelines and the chronic care model. We also understand that the doctors are missing the signs and symptoms of stroke, and that there's an increase in blood pressure in these clinic patients. So that is our situation that we are dealing with. So let's look at the other bookend of the logic model here in terms of the long-term outcomes. If we implement this solution or this program, what is it that we're trying to address or correct about this problem? Well, the long-term goal would be that we would expect to see a reduction in heart disease in these clinic patients. And also, we would hope to see a decrease in the strokes among those patients. A more medium-term outcome would be an increase in those patients that have high blood pressure, but they are keeping it under control. Now, there's going to be some other things that we'll want to keep in mind. We'll be looking at some of the assumptions, and these are just conditions that are necessary for success or special circumstances to be aware of this environment. And so some of our assumptions are that chronic care model changes are going to be maintained by the clinics and that their patients will maintain their blood pressure control. There are other contextual factors to consider, and these are just things within the environment that this program is going to exist. And so we want to be aware of these because these will interact with and can influence the success of our program. And so some of these factors are that there are going to be other risk factors and hypertension increases that we need to be aware of. And likewise, we know that there's going to be some patients that lack the resources to continue the treatment. So we're going to keep this in mind as we think about developing this program. So then what do we need? What would be some of the inputs or some of the resources? Well, as I mentioned earlier, Congress is funding this program. And we do know that there are a group of clinics that we are targeting. So those are some of our other resources that we'll be working with. And because we're going to be developing a program to roll out to the clinics, we are going to need to hire some instructional designers to develop some of the training materials. So these are just three categories or three groups of inputs. There could be other inputs that you might consider for a situation such as a facility or equipment, but these are just kind of three kind of basic examples of what some of those resources might be. So with these resources or inputs, what are we going to do with those? And so we're looking at activities. And this is just the kinds of activities that are necessary to help drive results. So we will be developing training, so that will be one of our products, and we will be providing that training to the clinic. So these are some of those activities that will be underway. And then the outputs. So the outputs are just a result of the activities. So think of things like products or deliverables. These would be things that are measurable, tangible, and really just direct, products or results of the activities. What we would expect as far as outputs would be that the clinics are educated about the clinical guidelines, and they also are educated on the chronic care model. So those would be some of those products or deliverables as a result of the activities that were created. So the next piece is just looking at a short-term outcome. And so this can result fairly quickly. I mean, this could be realized within weeks, it could be maybe realized within months, or potentially longer. So when you think about the outcomes in terms of timing, depending on the situation or the program, it can vary from weeks to months to years. But the short-term outcome would be an increase in the appropriate treatment that's being provided to the patients that have high blood pressure. And another short-term outcome would be that the clinics are implementing that chronic care model. So those would be some of the changes in the physicians and the clinics that we would expect to see as a result of this particular program. So in order to ensure that the program that we developed and implemented, that it had an impact on some of these outcomes, whether they were short-term, medium-term, or long-term, this is where evaluation will come in. We should evaluate, check, and verify, and we can do this at many points throughout this entire program. So one of the questions that I would be really interested in knowing is that did the program that we implemented, did we implement it as it was designed or as it was planned? Well, how would we know? What would be some of those indicators? Well, these would just be a few. The number of sessions, so if we had a certain number of clinics that we were trying to target, did we offer enough sessions for all of those clinics? So we would be measuring against that to determine if we had reached our target audience. And we would also want to know how effective was the workshop that was provided to the clinics. Was it relevant? Did it make sense? Did the physicians learn something new? Do they think they'll be able to apply what they learned within their clinics? So these would be a couple of indicators that I think would be useful to measure to help us understand if this was working as designed or if we need to make some changes to the program or to the way we're delivering the training. Another question might be, are we seeing any kind of change in knowledge or policy or environment? How would we know? What kind of indicators would help us in understanding this? Well, it could be that we're seeing an increase in the clinics that are following guidelines and an increase in the percentage of clinics that are applying the chronic care model. These would be some positive indicators that the program was effective and had an impact. So these would be some indicators. And again, I think, you know, if we are looking at some programs or maybe some particular needs within our organizations, if we're thinking about the desired outcomes and starting there first and then designing the program to deliver on that, then we could even possibly impact the number of CEOs, say, that are beginning to see an impact in their L&D investments and maybe positively impact that study that Burson had conducted this year. So as a key takeaway, just think about having a strategic consultative discussion, asking some very key questions. And again, that'll be on a job aid that we'll share with you after the webinar. And understand what the problem is first and the expected outcomes before jumping to designing solutions. And you can use this logic model to build clarity and consensus with your clients and colleagues. You can use it to help communicate assumptions and activities and outputs. And then always remember to evaluate, check, and verify to ensure that the business or performance outcomes were achieved. So thank you. Are there any questions?
Yep. So Pat, I'm going to go ahead and steal it back to me for just a second. That does bring us to the end of the 20 minutes. Pat, thank you for that great presentation, but we will go over just a few minutes because we do want to get to some of the questions that have come in. If you do have a question for Pat, be sure to enter into the Q&A module at this time. That's in the lower right-hand portion of WebEx. Obviously, we covered a lot in 20 minutes, and there's still a lot to discuss. So we encourage you to continue the conversation with Pat. You can see her contact information is up on the slide showing right now, and she'll also be putting together a blog post addressing some of the key takeaways and questions from today. As a friendly reminder, the recording and slides from today will be sent to the email address you provided within 48 hours, and as a bonus, Pat developed a great handout template around the logic model and a job aid for creating your own strategy, so we'll be including that in the email. One other thing that we'll be including, and then we'll get to these questions, is that she's also offered her time to put together a workshop, a hands-on workshop for everyone who's on this call. It is scheduled for December 2nd at 2 p.m. Eastern Time. The session is going to be free, and it's going to be an opportunity for you to work on the logic model and your own strategy while she's there to kind of help you walk through it, go through any questions, answer any questions. And this is going to be limited to only 10 seats, and we will be sending a link to the registration here after the call, so be sure to register if you're interested. It is limited. With that, I will get to these questions that are coming in. Pat, I'm going to kind of facilitate them to you, if that's okay with you.
Yes.
Okay. So the first one I'm going to get to is, are evaluation questions and indicators only used to evaluate outputs and outcomes?
They are not. You can use evaluation and indicators to evaluate inputs. Also look at the activities. You know, are you getting the activities or products done on time within budget? Do you have enough resources? You can evaluate the outputs as well. I mean, just looking at the result of those activities from a standpoint of effectiveness and efficiency. But you can evaluate and identify the appropriate indicators at any of that point in the logic model. You can look at it from a process standpoint as well. So it fits the entire logic model and all of the work that goes into that.
Great. So the next one is, what might the inputs column look like if there is only one trainer on staff or limited funding?
The inputs, I mean, it would be maybe the funding, your resource, your instructional designer. Also, inputs might be your subject matter experts potentially. Another consideration would be if there's, you know, any special equipment or, you know, materials that's needed for developing some of the products, then those could also be considered some of your inputs.
Great, and I do want to be mindful of time, so I'm going to do one more. If there are any other questions that come in or any that we haven't addressed, I see there's a couple more on here. We will follow up with those in that blog post. But I like this one because it's a broader topic, and I'm sure we could do a whole other webinar on this, but are there other uses for the logic model?
Yes, there are. You can use them to not only display what that program is and the activities and the elements of that program, but as we've seen here too, you can use it not only to design, but you can use a logic model for evaluation. You can use the logic model for communication. You can use the logic model for a very small program or process, or you can use it for quite a broad organizational change that could be quite a comprehensive logic model. So the scale can grow in the use of that logic model. So there's many, many applications, and I'd be happy to share some more ideas with you.
Great. Well, we are about 5 minutes after the session, so I'm going to go ahead and wrap up these questions for now. We'll go ahead and address them in the blog post. But thank you again to today's speaker, Pat Byers, and also thanks to everyone who attended for your time and attention. We do hope that you will join us for one of our future GP Strategies webinars. They can all be found on our website, gpstrategies.com. For GP Strategies, I'm Kayla Roth, and I wish everyone a great day.
Thank you.